Good morning. Denture PSA for patients getting immediate dentures. So I had a denture patient this morning, and she is about a week and a half out from her extraction date. I tell all my patients, when you get your teeth extracted, you have to be very, very, very careful in rinsing your mouth because your body is depositing new cells in those holes and on the edges of those holes to close up those holes where your teeth came out. Even though I explain this and explain it to my patients, sometimes they don't hear me. And sometimes the dentist gives conflicting information or gives conflicting statements that confuses the patient. And I'm going to give you an example. So this patient came in last week and she had been about 5 days out from extractions. She came in, actually I think it was about 8 days after extractions. She had come in and she was scheduled for a temporary soft reline, and her extraction sites, even though they had sutures over the top of them, were gaping open, all of her extraction sites, and her tissues were very red. Okay, so much so that I told her, you need to take your dentures out, even though that is not how I like to do it, but she had such bad inflammation that I had to have her take her dentures out for about 5 days to give her mouth a chance to rest and settle down in that inflammatory process to, be interrupted and calm. So she came in today and for a recheck, and again, I was going to do that temporary chairside reline on her. However, now her gums are even redder, even though she hasn't been wearing the denture for days. So I asked her, what's happening here? Are you rinsing and rinsing and rinsing? Are you using any products in your mouth? Because you're only supposed to be rinsing like twice a day, very gently. And she said, well, yeah, I'm doing that, but I'm getting food in those holes. And so the dentist had given me this little syringe. And so, boy, I had something stuck in a couple of them. And so I used that syringe. I think I've got it now. I've been squirting and squirting and squirting in there to get that food out of there. I wish that dentist did not give patients this. When I was about 26, I had my wisdom teeth pulled out, and I didn't realize all of these nuances. And my dentist gave me a syringe, and I don't even think he told me what it was for, but I figured it was for cleaning out those holes. You are disrupting the healing process. You're washing out those blood clots out of those extraction sites, washing away all those new little cells. That was the number one problem. The next issue was that she had been taking amoxicillin, and I believe this was prior to her extractions. The dentist had given her amoxicillin. She just finished it like yesterday, and so she's telling me this, and so I looked back in her mouth, and sure enough, she has thrush. She has thrush. There's a white coating all over her tongue and a little bit on the inside of her cheeks, and that's that inflammation. That is a yeast infection basically in your mouth. So when you take antibiotics go after the bad bacteria. That's why you're taking them. But they're so strong, and amoxicillin is a big gun antibiotic that also takes out the bad bacteria and the good bacteria, and it can throw off your natural balance of bacteria in your body. There's always bacteria living on us and in us, and there's good and bad. Sometimes the bad overgrows and you need to take antibiotics, but then it can wipe out that good bacteria, and now we have an overgrowth of other bacteria, yeast, fungus. So now I've got to wait a few more days to even look and see if that's getting cleared. I had to call the dentist office. I don't prescribe, I'm a denturist. So I called the dentist office and told them what I was seeing, and suggested maybe some Niastantin. So I guess the PSA is, be very careful what you do. Make sure you get thorough instructions. If you have questions, ask, and listen carefully to what your provider is telling you, and do your own research. to kind of learn the ins and outs of these things. That's why I'm on here. That's why I'm giving you this information. And I certainly hope it helps. Have a great day. Bye-bye.